Hi, hello, welcome to the Agni Nursing Academy. In the today's session, we'll discuss important MCQs. In the last session also, we have discussed already MCQs, which is very helpful in our upcoming competitive nursing exams. I will see the first question on your display. Copies cross, tells stories and goes to toilet alone. What is the age of the child? Option A, 3 year. Option B, 4 year. And option C, 5 year. And option D is 2 year. Before going to this MCQ answer, we'll discuss some key milestones. First, we will discuss 2-year key milestones. In the 2-year key milestone, the child is able to walk independently. Child is able to walk independently, walking, and is also able to do running, and also build the tower of six cubes. Build tower of 6 cubes, and they are having vocabulary of 300 words. Vocabulary of 300 words. We'll see the 3-year milestones. In the 3-year milestones, the 3-year childs are like, if we are telling anything also, they will ask the more and more questions, and they will know about, if we are asking what is your name means, they will tell their about gender and name also. If they are asking questions, and they know about their full name, gender, and they are also able to ride the tricycle, and also they are able to climb the alternative steps also. Climbing alternative steps, alternate steps, and also they are able to do dressing themselves, dressing and undressing, and also they are able to build tower of 9 to 10 cubes, and they are having vocabulary of 800 to 1000 words, vocabulary of 800 to 1000 words, and they are also able to turn pages at a time, book pages at a time, You see the 4-year milestones. In the 4 years, the child is able to copy, cross, or square or rectangle, and then telling stories, and can go alone, toilet alone, and also they are able to put their shirt button. In the 5-year milestone, 5-year, they will tie the shoes lace, and also draw the triangle, able to triangle, and they will, in the 5 years, they will jump on ropes also, jumping on ropes. We'll see the answer for our question. Copy cross tells stories and goes to toilet alone. I told in the 4-year these milestones occurs. Because of that's why answer for our question is option B. That is 4-year is the correct answer for our question. We'll see the next question. All the following are included under diagnostic criteria of severe acute malnutrition except option A, height for age, option B, weight for height, and option C, pedal edema, and option D, mid upper arm circumference less than 11.5 centimeter. We'll discuss some important points which is very helpful in your exams. Question will arise from this only. Decreased weight for height we'll call as a wasting, and decreased height for age we call as stunting. I'll discuss diagnostic criteria for severe acute malnutrition. Severe acute malnutrition we will see in the age of from 6 months to 5 years of age. We can diagnose by mid-upper circumference and weight for height or length, and also diagnosed by edematous status also. In the severe acute malnutrition, there is a mid-upper circumference is less than 11.5 centimeter, and the weight for height is less than -3 standard deviation of WHO, and the bilateral pedal edema, it also called as pitting edema, is present in the severe acute malnutrition. In the case of severe acute malnutrition, the protein, it is a deficiency of protein. If deficiency is there, means there is plasma protein which is produced by the liver, that is also decreases. If plasma protein level production decreases, means the oncotic pressure also will be decreased. After the oncotic pressure decrease, the fluid leakage is present in the cells. Because of that's why edema will present in the severe acute malnutrition. And mid upper circumference, normal it is more than 12.5 centimeter. We measured by mid-upper circumference is measured by Shakir tape. In the Shakir tape, there are three color codings present according to the mid-upper circumference. See, first, mid-upper circumference less than 11.5 centimeter. If mid-upper circumference between 11.5 centimeter to 12.5 centimeter, and if more than 12.5 centimeter, we'll tell that if mid-upper circumference is less than 11.5 centimeter, then it is sorry, it's red zone. It's a red zone. If the mid-upper circumference in between the 11.5 centimeter to the 12.5 centimeter, means it's yellow zone, and the mid-upper circumference is more than 12.5 centimeter, then it's green zone. We'll see the answer for our question. Option A, height for age, not included, will not diagnose by the height for age. And option B, weight for height, yes, correct. Option C, pedal edema, is correct. And option D, mid-upper circumference less than 11 centimeter. Ask the question is accept. That's why answer for our question is A is the correct answer for our question. That is height for age. Is that correct answer? We'll see the next question. A 6-week-old infant presents with failure to thrive and poor feeding. He complains of non-bilious vomiting immediately after feeding, which starts 3 weeks after birth. The vomiting is forceful but not projectile. Bowel movements are normal. Per abdominal examination has no significant findings. What is the most probable cause? They asked the cause. What is the cause for forceful vomiting and non-bilious vomiting? We'll see the options. Option A, cow milk protein allergy. Option B, GARD. And option C, intestinal obstruction. And option D is pyloric stenosis. First, we will see the intestinal obstruction. In the case of obstruction, in the intestinal obstruction, if intestinal obstruction is there, means bilious vomiting will be present. And in case of intestinal obstruction, there is abdominal distance also. And in the case of intestinal obstruction, the bowel movements are absent. In intestinal obstruction, bowel movement absent, and bilious vomiting also, and abdominal distress, In case of cow milk allergy, it occurs with possible some evidences. If cow milk allergy present, means it occurs with blood in stool, and eczema. In the question, not mentioned anything about the blood in stool and eczema. We'll see about the pyloric stenosis. In case of pyloric stenosis, we'll discuss some important assessment findings only in this significant findings. In case of pyloric stenosis, regurgitation is present, and also the bilious vomiting, So in the pyloric stenosis, non-bilious vomiting will be present. In the pyloric stenosis, non-bilious vomiting will be present. Projectile vomiting, but in the question they told non-projectile. But special feature in the pyloric stenosis is there is a mass present, mass alive shaped mass present, and also the visible peristaltic movement, visible peristalsis movements present in the pyloric stenosis. But in the question given, there is no significant finding also the on abdominal examination. That's why option D is also we are removing. Option A also not the answer for our question, and option C also not answer for our question. Answer for our question is GRD. That is option B is the correct answer for our question. That is GRD. Gastroesophageal reflux disease. We'll see the next question. A 6-month-old child unable to sit with support but can roll over from side to side. The child can say words like mama and dada and exhibits strange anxiety, becoming distressed upon encountering unfamiliar people. What is the appropriate next step in the managing the child's development? Option A, reassurance since it is a normal development variant, and option B, immediate referral to assessment of development and perform cranial MRI, and option D is start physical therapy to help her sit. In this 9-month-old child unable to sit with support but can roll over, roll over it is in roll over it is in 6 months. Okay, able to roll over at 6 months means age is 9 months, it's a normal, and the child can say mama and dada bisyllable, that is it is occurs in 9 months of age. 9 months age child is 9 months, then it is also normal. And stranger anxiety at develops at 6 months. Its age of the 9 child is 9 months, then it is also normal. But here we observed that unable to sit with support, the child sit without support at 8 months, and with support at 6 months. But everything is having their borderline age. In this also, if the child is unable to sit up to the 10 months, then we'll call as a abnormal, it is delayed, we'll call as a delayed if not develops after 10 months also. 10 months, because of that's why the answer for our question is option A. Option A is the correct answer for our question, and we'll see the development delay age in the next slide. Development delay, if they are not developed up to this month age also means, then we'll call as a developmental delay. Developmental delay is also called as red flag sign. We'll see there's no visual fixation following by up to the 2 months, then we'll call as a developmental delay. And no vocalization by 6 months, and not sitting with support, here it is there 10 months. Up to the 10 months, if baby is not sitting without support, then we'll call as a developmental delay. And not standing alone by 16 months, and not walking alone by 18 months. Up to this age also, if not developed growth and development proper means, we'll call as a developmental delay, and afterwards only we'll call as this is an abnormal thing. Up to this age we'll call as a normal only. Okay, we'll see the next question. A 4-day-old neonate is being breastfed by her mother. Consider the following. A. Cheeks and mouth are full. Lower areola more visible than the upper areola. C. Chin touches mother's breast and lower lip inverted, which shows proper attachment. Option A. It is a SATA question. That is select all that apply. Option A is first option is A, B, and C, D. Option B is A and C. Option C is A, B, and C, and option D is B, C, and D. We'll see the proper technique for breastfeeding. Proper attachment. Proper attachment means it's latching, also called as latch. We'll see the image. It's good attachment techniques. Good attachment technique. Techniques of breastfeeding. Just observe the baby chin touches the mother's breast. Chin touches mother's breast or against breast. Against breast. And see the mouth of the child is widely open. Widely open. Widely open and filled with milk. Because of that, the mouth will see like a full, wide open mouth, and cheeks are full. Cheeks are full because of the child is having milk in his mouth. And third one is just observe the areola here. Upper areola is visible and lower areola is not visible. Almost all areola present in the baby's mouth, but can visible upper areola, not a lower areola. Upper areola can visible and seen here. Lips observed, chin also observed, and areola also observed. Afterwards, the latching techniques is very important during the breastfeeding, and we have to feed the baby properly. And again, it's in the question they ask for lower lip. See the lips here. Low lips are flagged out. Lips are flagged out. Means we'll call that one is everted, not a inverted. Lower lips are everted. We'll see the answer for this is good attachment techniques. We'll see the answer now. Cheeks and mouth are full. It's a correct. Lower areola more visible than the upper. No. It's upper areola more visible than the lower areola. And chin touches mother's breast. It is also correct. And lower lip is inverted. Not inverted. This one is everted. Everted. That's why answer for our question is option B. That is A and C is the correct answer for our question. Option B is the correct answer, and this is the breastfeeding good attachment techniques. We'll go to the next question. A term unit presents with a soft swelling over the parietal region that does not cross the suture lines, and the most likely diagnosis is option A, caput succedaneum, option B, cephalohematoma, option C, subgleal hemorrhage, option D, meningocerebral. We'll see in the image. First, we'll discuss image A, caput succedaneum. Before going to caput succedaneum, just see the layers of scalp. This one is there. See this one brain. This one is dura mater, and this up to from there it is bone layer, and bones covers one layer that is periosteum. Upper the bone that is loose connective tissue is there, and this one is aponeurosis and connective tissue and skin is there. In the caput succedaneum, edema is present. The edema present because of the during the delivery of the fetal head, maternal pelvis, the baby's head passes through the maternal pelvis. Then compression will pressure present, cervical ring pressure present on the fetal head. Because of that's why there is no proper drainage of fluid. That's why the fluid collection will occur. The fluid collection or edema present between scalp and periosteum. Scalp and periosteum. And the swelling is, if we are palpating, is able to that compress also. You can compressible, and this fluid collection able to crosses the suture line, cross the suture lines also, and This compound succedaneum fluids collection is there. There is no need of treatment. It's self-resolving within 48 to 72 hours. 72 hours. And it occurs at birth only. Occurs at birth. Occurs at birth. This is about the compound succedaneum. Next we will see cephalohematoma. Cephalohematoma. In the cephalohematoma, here see, bone is there, but bone covered layer periosteum is there. The fluid connection between the bone and periosteum layer is blood. In the name itself, it is cephalon means head, hematoma means blood. Blood collection between skull bone, not the blood collection between okay, skull bone and periosteum. In case of cephalohematoma, if we are palpable means it's a hard, non-compressible, hard and non-compressible. In cephalohematoma, not crosses the suture lines, and it will resolve within 6 weeks. 6 weeks. If it is not resolving, incision and drainage procedure we will do. The cephalohematoma, it occurs because of the same when the baby's head passes through the maternal pelvis. Because of the cervical pressures on the fetal head, there is chances of minor emission veins will be ruptured, because that's why blood collection will occur between the bone and periosteum. And next one we will see the subgleal hemorrhage. In the subgleal hemorrhage, it's an emergency condition. It's an emergency condition. Here there is a blood collection between the aponeurosis and the periosteum, and it is also crosses the suture lines. The subgleal hemorrhage also crosses the suture lines, and there is a chances of fluid shifting, and hypovolemic shock also will occur in the subgleal hemorrhage. This is an emergency condition. Now we will go to the our question and we'll see the answer. And another one is the meningocele here. Meningocele is a neural tube defect. It will not diffuse the our skull swelling over the region, parallel region. Our answer for our question is, it will not cross the suture lines. It's cephalohematoma. Option B. Option B is the correct answer for our question. It is a cephalohematoma. Cephalohematoma is the correct answer for our question. Here it is the C condition. Key features of acute succedaneum: element swelling of the scalp present at birth only, and crosses suture lines, feeds on pressure and resolve within the 48 to 72 hours. And see the cephalohematoma, it is a periosteal bleed because of the just below the periosteum layer bleeding will occur. That's why subperiosteal bleed will cause, and it does not process the suture lines. And it occurs after the birth only. After the up to the 24 hours, it will occur. And periosteal, the subgleal hemorrhage also I told, and meningocele also I told. It's a neural tube defect with CSF inside through skull defect, not diffuse, called skull swelling. We'll go to the next question. Which observation in newborn of diabetic mother would require immediate nursing intervention? Option A, crying. Option B, wakefulness. Option C, jittery movement. And option D is agony. Crying. Crying, it is abnormal? No, it's a normal only. All childs will tell here will tell that first cry is the first aspiration of the newborn. This cry is normal in the newborns. It is also normal. Wakefulness after sleeping, the child will show the wakefulness after sleep. It is also normal. And agony, when child's tired, they will do the movement like that. When we'll tide, we'll do the movement, it will called as Agni. It is also normal. But jittery movement, it occurs because of hypoglycemia. If hypoglycemia is not treated in the diabetic mother, it causes seizures. It causes the seizures. Okay, seizures. I want to discuss about the newborn of diabetic mother. Some important points. Newborn of diabetic mother. We'll discuss some important this one. In the newborn of diabetic mother, first we have to assess for hypoglycemia. Hypoglycemia. Hypoglycemia occurs because of mother is having more glucose level in her blood. The nutrition passes through umbilical cord to the her baby. Like that only high glucose level pass supply to the newborn fetus also. Because of manage the blood glucose level, the fetus pancreas will produce the more insulin level to manage the blood glucose level. But after the delivery, what will happen? After the delivery, will remove the supply by the cord cutting. But the fetus pancreas will be produced same number, same thing, same amount of insulin after the cord cutting also. Because of that reason, hypoglycemia will occur in the newborn of diabetic mother. And another things, that is hypocalcemia. Hypocalcemia because of the immature parathyroid hormones. Calcemia because of immature parathyroid hormones. And another one is, you will see the in the diabetic mother, uh, what will happen? Some new congenital abnormalities will present. Congenital abnormalities. Abnormalities. It's important, and already previously asked a question. This one previously asked a question. We'll see the most common congenital abnormalities, that is neural tube defect, special one, caudal regression syndrome, and congenital heart defect also. In the congenital heart defect, most common is VSD, ventricular septal defect, and the most specific is TGA, transposition of great arteries. TGA. These are the congenital abnormalities occurs in the neonate of diabetic mother. Answer for our question is option C. Option C is the correct answer for our question. That is jittery movement. Because of hypoglycemia, jittery movements happens. We'll go to the next question. Breastfeeding should be started in how many hours of life after delivery? Option A, 1 hour. Option B, 2 hours. Option C, 3 hours. And option D is 4 hours. In the normal vaginal delivery, we'll start the breastfeeding as soon as possible or within the hour. Within 1 hour or as soon as possible. As soon as possible. In the LSCS, in the cesarean section, up to 4 hours, we can start the 4 hours, we can start the breastfeeding up to 4 hours. If LSCS not mentioned in the question or cesarean section not mentioned in the question, means it's a normal vaginal delivery. We are able to start the breastfeeding at 1 hour. Option A is the correct answer for our question. Option A is the correct answer. We'll see the next question. A post-term neonate is defined as born more than option A 40 weeks, option B 41 weeks, option C 42 weeks, and option D is 43 weeks. We'll see that when we call preterm, postterm, and term. Preterm, term, postterm. Postterm. If neonate born less than 30 weeks, 37 weeks of gestation, then we'll call as a preterm. If the term, if baby born between 37 to 42 weeks, then we'll call as it is a term baby. If the child born, it's neonate born more than 42 weeks, then we'll call as a post-term. And some other points also there. It's extremely preterm. If child born less than 20 weeks of gestation, then we'll call it as an extremely preterm. And another one is the very preterm. If child born between 28 to 31 weeks plus 6 days plus 6 days, then we'll call as a very preterm. And another one is the moderate preterm. Moderate preterm, it's the born between the neonate born between 32 to 33 weeks plus 6 days plus 6 days, then we'll call as a moderate preterm. In our question asked, that is post-term asked in the question, answer for our question is, if child is born more than 42 weeks, then we'll call as a post-term. Option C is the correct answer for our question. We go to the next question. What is the dose of vitamin A required for 11-month-old female child? Option A 50,000 international unit, and option B is 1 lakh international unit, and option C is 2 lakh international unit, and option D is 3 lakh international unit. Let's discuss about the vitamin A doses. Vitamin A doses. We'll give the first dose at 9 months, and second dose between 16 to 24 months. After that we'll give the every 6 months up to 5 years. And see now doses. If the age is less than 6 months, we'll give 50,000 international unit. If age is 6 months to 12 months, then we'll use 1 lakh IO, 1 lakh international unit. If the child is more than 1 year, then we'll give the 2 lakh international unit. If the child is more than 1 year, but weight less than 8 kg, if the weight is less than 8 kg, then we will give the 1 lakh international unit vitamin A dose. Total dose will give up to the 5 years, means total dose of vitamin A is 17 lakh international unit. In the 5 year total 17 lakh will give. You see the answer. Vitamin A required for 11-month child. The age is less than 1 year, means 1 lakh international IU. Answer B is the correct answer for our question. Option B is the correct answer for our question. That is 1 lakh international unit. Okay. And other MCQs we'll discuss in the next class. Thank you.